Exam. At any time, please feel free to pause or replay this video. The most substantial differences in the 1995 and 1997 versions of the E&M documentation guidelines occur in the examination documentation section. For billing Medicare, you may use either version of the documentation guidelines for a patient encounter, not a combination of the two. We have chosen the 1995 guidelines as these are the most appropriate for the hospital setting. An examination may involve several organ systems or a single organ system. The type and extent of the examination performed is based on clinical judgment, the patient history, and nature of the presenting problem. As per CMS, the following organ systems are recognized. The following body areas are recognized. A problem-focused exam consists of one body area or organ system. An expanded problem-focused exam consists of 2 to 5 body areas or organ systems. A detailed exam consists of 6 to 7 body areas or organ systems. A comprehensive exam consists of 8 or more organ systems. Please take a moment to review the different code sets used for inpatient and observation visits. Please note the differences between initial and subsequent visits for the inpatient and observation services. The following is an example of a comprehensive exam. Please take a moment to review the following scenario. Keep the following in mind when documenting an exam. Only organ systems are given credit for a comprehensive level of exam. Body areas are not counted. Specific abnormal and relevant negative findings of the examination should be documented. A notation of abnormal without elaboration is insufficient. Documentation should always include examination of the affected organ system. Abnormal or unexpected findings of the examination of any asymptomatic body area or organ system should be described. A brief statement or notation indicating negative or normal is sufficient to document normal findings related to unaffected areas or asymptomatic organ systems. When pelvic or rectal exam for an adult is deferred, document the reason. The exam is real-time. One cannot indicate no change in the exam from the previous encounter. The medical record is a legal document that is required by law and regulatory bodies. An incomplete or deficient medical record demonstrates that care was incomplete, contributes to inaccurate quality and care information, and causes lost revenue and reimbursement. This training video is brought to you by Practicefirst.